Wes from NewFrame here. Today we're going to talk about inflammation. Now, inflammation gets a bad rap out there. It almost seems like it's talked only in a negative light. But today I wanted to shine on the good and the bad of inflammation, because there's two sides to every story. So first, let's take one type of inflammation. This is called acute inflammation. Now, acute's just a word that means it happens quickly. This is the type of inflammation that you would get if you'd say sprain your ankle or hurt yourself quickly and that joint or area kind of swells up a bit. And this is an important thing because if we didn't have this, we would heal a whole lot slower. See, the purpose of inflammation is to bring more blood to an area, because what does blood have? Blood has all those healing components of our body. It's got different, you can think of it as the different building blocks of rebuilding those cells. So the more blood that gets shunt to an area, the faster the healing rate is going to be. So that's why you see almost as soon as you sprain that ankle, it starts swelling up a good bit. And it's because the body and the brain want to say, hey, let's get that healed up. Now, like I said before, acute inflammation is a great thing. It helps bring a lot of those things that we need to heal a certain area to that area, and it just improves our ability to get back on our feet quicker. However, the body and the brain can get a little out of hand sometimes. And we see this a lot when working with people who are really on the early side of the coin. So if someone just sprained their ankle or if someone just had surgery, we get a whole lot of inflammation going on there. The main reason for that is the body just knows that it had some type of injury and is trying to get as many resources down there as possible. And this makes sense because it would rather do that, get you off your feet, let you heal up a bit, and then slowly ease down on that inflammation. But like I said, sometimes it can go a little haywire. And this brings me into our second point here of chronic inflammation. Now, chronic inflammation is different than acute inflammation as it lasts a whole lot longer. And generally, it doesn't just stick to one spot. It's a global inflammation. So you can think of it as a whole body inflammation. And this isn't something that you want, generally speaking, because what does that inflammation do? Well, it makes everything more sensitive. It makes our nerves more sensitive. It makes our joints more sensitive. It makes just movement more sensitive. And that's the thing about chronic inflammation. It's kind of a result of our bodies being in this highly stressed out and painful place for a long period of time. And what our goal is with chronic inflammation is to help decrease it overall. Now, before we get into the decreasing, I kind of want to go into a little bit of an analogy to how chronic inflammation works. You can kind of think of chronic inflammation as a thermostat in your house. So if you crank up your thermostat to, let's say, 90 degrees, that whole house is going to be flared up. It's going to be heat. It's going to be really heated. You're going to be uncomfortable no matter where you are in your house. And it's just not going to be a pleasurable experience. Now, that's kind of like how chronic inflammation is. It cranks up all of our unpleasantries in our body. And that's why sometimes you can get pain in areas that haven't really hurt before. It's because that inflammation helps, well, I say helps in a loose term. It affects all these different areas of our body. So what our aim to do then with chronic inflammation is to help take that thermostat and tune it down a little bit. So instead of it being a 90, we're going to bring it down to 80. Now, is 80 the most comfortable level for you? Maybe some days in winter it is, but most days that's not going to be the case. So with that said, one of our goals is to turn down that thermostat. And the question you may be asking yourself now is, hey Wes, how do we do that? And if there was one answer, it would be really easy, but there isn't. There's 1,000 ways we can attack this. And there will be certain ways that work better for you and certain ways that work better for the next person. However, we have a few that generally work for everyone. And that's what our program, the NewFrame program, helps kind of go through. A lot of times, just tuning in to how our body's feeling and also learning about some of this stuff can help bring down that inflammation, high set point there. And we can bring it down to a more lower set point. I can go into specifics, and usually through our Instagram page and our Facebook page and our other social media pages, we give little tips and tricks. But this video is probably getting a little long enough as it is. So let's end it here for now. I hope that helped shed some light on the different types of inflammation and what that means for you. If you have any questions, please let us know, and we'd be happy to answer them. Until next time, take care.